Understanding secondary and associated conditions in children with cerebral palsy includes feeding and swallowing difficulties, nutrition and respiratory issues, intellectual, visual, hearing impairments, and epilepsy. Learning characteristics, attention, memory, language, communication, cognition. Co-occurring conditions across age and disability. 1. What is a common feeding issue in children with cerebral palsy? A. Overeating. B. Difficulty in chewing and swallowing. C. Frequent vomiting. D. Strong appetite. Answer. B. Difficulty in chewing and swallowing. 2. Poor nutrition in children with CP is often due to yeast. A. Lack of appetite. B. Muscle overgrowth. C. Feeding difficulties and energy expenditure. D. Infections. Answer. C. Feeding difficulties and energy expenditure. 3. Which respiratory problem is commonly observed in children with cerebral palsy? A. Lung cancer. B. Asthma. C. Recurrent chest infections and aspiration, pneumonia. D. Bronchitis only. Answer C. Recurrent chest infections and aspiration pneumonia. 4. Epileptic seizures in children with cerebral palsy are considered A. A behavioral issue. B. A secondary condition. C. A dietary problem. D. A sign of improvement. Answer. B. A secondary condition. 5. Children with cerebral palsy may experience vision problems such as A. Cataract only. B. Night blindness only. C. Cortical visual impairment. CVI. D. Only double vision. Answer. C. Cortical visual impairment. CVI. 6. Which of the following is an associated condition of cerebral palsy? A. Diabetes. B. ADHD. C. Impaired hearing. D. Heart murmur. Answer C. Impaired hearing. 7. Poor oral motor control in children with CP may lead to A. Loud talking. B. Difficulty in speech and eating. C. Increased IQ. D. Reduced breathing. Answer B. Difficulty in speech and eating. 8. Epileptic seizures in CP are due to A. Nutritional imbalance. B. Brain damage or malformation. C. Cold climate. D. Stress only. Answer B. Brain damage or malformation. 9. Children with cerebral palsy may need feeding via A. Mouth only. B. IV fluids. C. Nasogastric or gastrostomy tube. D. Eating independently always. Answer C. Nasogastric or gastrostomy tube. 10. Malnutrition in CP can result in A. Heightened immunity. B. Good muscle tone. C. Growth delays and low weight. D. Increased activity. Answer C. Growth delays and low weight. 11. Children with cerebral palsy may face difficulty in A. Recognizing colors only. B. Physical strength. C. Attention, memory and concentration. D. Watching TV. Answer C. Attention, memory and concentration. 12. Which learning difficulty is commonly associated with CP? A. Dyslexia. B. Hyperlexia. C. General learning delay or intellectual disability. D. Photophobia. Answer C. General learning delay or intellectual disability. 13. Sensory motor perception issues in CP may cause A. Hyperactivity. B. Inability to judge space and direction. C. Enhanced perception. D. None of the above. Answer is B. Inability to judge space and direction. 14. What aspect of communication is often impaired in CP? A. Volume control. B. Fluency. C. Expressive and receptive language. D. Eye contact. Answer C. Expressive and receptive language. 15. Children with CP may have delays in A. Emotional maturity. B. Artistic skills. C. Cognitive and academic skills. D. Writing poems. Answer C. Cognitive and academic skills. 16. Which condition may affect both feeding and speaking in CP children? A. Oromotor dysfunction. B. Knee injury. C. Sleep apnea. D. Common cold. Answer A. Oromotor dysfunction. 17. Children with CP may require A. More visual learning. B. More written tests. C. Individualized education program, IEP. D. Constant shouting. Answer. C. Individualized education program, IEP. 18. Learning may be improved in C. P. Through is to A. Punishment. B. Rote memorization. C. Multisensory instruction and repetition. D. Ignoring their needs. Answer. C. Multisensory instruction and repetition. 19. Language delay in C. P. may be due to A. Lack of interest. B. Parental negligence. C. Motor planning and control issues. D. Watching too much TV. Answer. C. Motor planning and control issues. 20. Visual perception difficulties can affect A. Drawing. B. Orientation in space and letter recognition. C. Smell. D. Hearing. Answer. B. Orientation in space and letter recognition. Section C. Other co-occurring conditions. 21. Which co-occurring condition may require special seating or positioning? A. Toothache. B. Visual impairment. C. Poor posture and muscle tone. D. Asthma. Answer. C. Poor posture and muscle tone. 22. Which behavior may be seen in C due to attention difficulties? A. Sleepwalking. B. Repetitive questioning. C. Easily distracted and short focus time. D. Constant writing. Answer. C. Easily distracted and short focus time. 23. What is a common type of memory challenge in CP children? A. Hypermemory. B. Sensory memory loss. C. Working and short-term memory deficits. D. No memory issues. Answer. C. Working and short-term memory deficits. 24. Auditory processing disorder in C. P affects A. Taste. B. Smelling ability. C. Understanding spoken language. D. Drawing skills. Answer. C. Understanding spoken language. 25. Visual motor integration helps with A. Balancing. B. Eating. C. Writing and copying. D. Reading aloud. Answer. C. Writing and copying. 26. Coordination problems in C. P affect A. Visual focus only. B. Fine and gross motor skills. C. Memory. D. Blood pressure. Answer. B. Fine and gross motor skills. 27. Which learning method helps children with CP? A. Only lectures. B. Hands-on activities and visual aids. C. Only reading books. D. Writing long essays. Answer. B. Hands-on activities and visual aids. 28. Cognitive delay may include A. Poor reasoning and problem solving. B. Quick response. C. High IQ. D. Good imagination only. Answer. A. Poor reasoning and problem solving. 29. Children with CP may learn better when given A. Fast instructions. B. Complex assignments. C. Clear, simple, repeated instructions. D. Group punishment. Answer. C. Clear, simple, repeated instructions. 30. Which tool supports communication in non-verbal CP students? A. Earplugs. B. Glasses. C. AC devices, augmentative and alternative communication. D. Notebook. Answer. C. AAC devices, augmentative and alternative communication. 31. Visual field problems in CP may cause A. Inability to hear. B. Fear of light. C. Poor scanning and tracking. D. Strong eyesight. Answer. C. Poor scanning and tracking. 32. Language delay due to hearing loss in CP is considered A. Primary condition. B. Cultural issue. C. Associated condition. D. Eye-related issue. Answer. C. Associated condition. 33. Children with CP and intellectual impairment may struggle with A. Making friends. B. Complex instructions. C. Smiling. D. Playing. Answer. B. Complex instructions. 34. Feeding difficulties are due to A. Hunger. B. Weak hand control. C. Poor oromotor coordination. D. Poor eyesight. Answer. C. Poor oromotor coordination. 35. Which of the following helps manage seizures in CP? A. Speech therapy. B. Physical education. C. Anti-epileptic medication. D. Meditation only. Answer: C. Anti-epileptic medication. 36. How can learning be made easier for a child with CP and memory issues? A. Long lectures. B. Use of pictures, repetition and prompts. C. Ignoring questions. D. Fast-paced teaching. Answer: B. Use of pictures, repetition and prompts. 37. Cerebral palsy may be accompanied by which developmental disability? A. SLD. B. Autism. C. Both A and B. D. None. Answer: C. Both A and B. 38. Muscle stiffness in CP is known as A. Flexidity. B. Hypotonia. C. Spasticity. D. Atrophy. Answer: C. Spasticity. 39. How do sensory motor issues affect writing? A.